Let's move into root canals. This is an area in the natural health world, a lot of fear around it, a lot of horror stories. Let's start out talking about what they are and when somebody typically would get one.
Yeah, there is a lot of, and I think you used the right word, terror when it comes to and fear mongering. And I mean, I would much prefer not to have a root canal. But then again, if you say no to the root canal, then you're missing the tooth. New study just broke the other day. You can almost correlate the number of missing teeth to how soon and how bad your rheumatoid arthritis will be. I mean, it's you don't live as long when you start losing teeth. Probably has something to do with digestion and processing of food in the mouth before it gets to the gut and the the colon and the large intestine. So, gosh, root canals. You're kind of damned if you do, damned if you don't. And as a practitioner, whatever you say, people are just gonna. It's as emotional as the fluoride debate. It's almost as emotional about the nanohydroxyapatite. Boy, that's a new debate in dentistry. So let me just give you the best advice that I can give you. Okay, I've done a lot of root canals in my career. The methodology has changed. It's gotten much better. I do agree. I agree with the anti-root canal people. And again, it's based on one book from the 40s. It kind of started with that. There's a dentist in Oregon that says, take them all out, put in implants. That's the basis for his business. It's a bit much. He has lots of good before and afters and horror stories and all that. But the majority of stories are fabulous. So starting about 15 years ago, I started taking CRP blood tests on all of my patients, or if they already had them as a baseline, and then I would take them after the root canal and then over time. So, and what that does is it measures the inflammatory response. If the body's fighting an infection, that CRP will elevate. There are other tests too. There's another test, platelets and all that, and white blood cells. But because I was curious, and so the gist of it is a well done root canal will remove enough bacteria and prevent them from recolonizing in this interior space of the tooth. This is, you come in from the top of the tooth, you drill a small hole, smaller the better. We call that the access point. And if you drill too big, then you've weakened the tooth. It may crack, even with a crown on it or a filling. Small hole, you get to however many pulp chambers there are, and you remove the blood vessels and the nerve tissue and the pulpal tissue, which is a mesenchymal tissue. It's the tissue that helped form the tooth. And it's there for a good part of your life. Now, as you get older, the tooth internally calcifies, and a lot of people will have teeth that will lose sensation and are non-vital because that tissue is lost. People that grind their teeth a lot, that process is hastened. But anyway, that tissue could be inflamed or infected. We call it hyperemic pulp or irreversible pulpitis. Pulpitis is a swelling of the pulp. And what causes that? A cracked tooth, trauma to the tooth, bacteria getting to the tooth via a cavity, many possible reasons. Poor dentistry is a big cause for teeth needing root canals. But anyway, the pulp gets irritated. The host is in a lot of pain. Spontaneous pain, hot and cold, pain to hot and cold. There's lingering pain. So really you want to get pulp tested. There is this progression of reversible pulpitis to the point where you cross over to irreversible pulpitis. Reversible pulpitis sometimes is misconstrued as irreversible pulpitis, and the dentist goes in there and he also wants to get the patient out of pain because reversible pulpitis is very painful. But there's a chance that the tooth can heal itself given the right treatment and anti-inflammatories and maybe remove the insult, whatever it may be. Doesn't always happen though, but it's very difficult to know in what state that tooth is. So get the tooth pulp tested. Don't say I don't want a root canal because the alternatives are expensive and difficult as well. And implants are not perfect and have similar issues as do root canals in terms of post-op infections and seeding the rest of the body with bacteria. So if the root canal is done properly, and these days that's with a massive microscope that sits in the corner of the room on wheels, and it's usually made by Zeiss, and it's rolled over, and the endodontist is looking through that. They're using lasers, they're using ozone. They have more control and command of removal, cleaning, debridement, and then filling and sealing off that chamber. And again, the fill and seal is only to the tip of the root. And once that's all cleaned out, that tooth, the body still is clinging to the tooth via fibers, periodontal ligaments. And the body can do well with that. Now, every few years, I would test that tooth. I'd get a 3D image. If it's tender to percussion, if there's some referred pain at any time during the existence of that root canal, you don't want to leave a poorly done or a failed root canal. And that's where the horror stories come. And again, it's a small percentage. I would say it's smaller than the horror stories for wisdom teeth. A failed root canal is a big deal. It can take you down. It can seed your blood vessels and other organs, including the brain, possibly even a fetus, with some bad, bad stuff, bugs, and can kill you, possibly. Very, very rare. But so can gum disease. So can other oral infections as well. So that's where the horror stories come from. And unfortunately, there are a lot of poorly done root canals. They're done very quickly. Dentists love it because 80% is covered by the third party, and root canals are expensive. So every time a dentist sits down and does a root canal, he's getting paid $800-900, and they try and do it in one visit. Do a root canal in several visits, especially if it's a hot tooth, if it's painful, if it's had a lot of inflammation. Don't jump right to it. Make sure that it is pulp tested properly. And when you do get the treatment done, get it done properly. Make sure your dentist is, and I can give you a list of a few if you want. There are not many that use the very, very high-end laser ozone techniques, but they're growing. And the specialty of endodontics, the root canal specialist, has risen to the occasion to making this better. But people have lived with root canals for a long time. Someone who has a root canal, a woman who has a root canal here does not get breast cancer on this side. These are all myths. Can you get cancer from a root canal? Yes, but it's not on the same side. I mean, that's not how the body works. You can get other cancers. That is from a leaky root canal that has been ignored, that is failing, that has an unfilled canal that the provider missed. Anyway, so, and the alternative is you can't just take the tooth out and leave it empty, leave that area edentulous. Because that leads to problems as well. Your bite will change. You'll start getting TMJ, and then another tooth. You'll lose another tooth, and that's not a good thing as well. So again, there's always a more nuanced version of the fear mongering that you see online, unfortunately. And so that's you got to maintain that tooth. You got to watch it. If it does fail, jump on it. Get your CRP measured. I get mine measured every year. Just want to know, is my body fighting something? And if it is, then I'll fix it, find out what the root cause is. Could be a root canal, right? Maybe. And then deal with it and then measure again until your CRP is low again. This is how you have to do it. You have to do it based on the data, not the hype and not the fear.
It's a lot of work taking care of this mouth.
It is. And it is a lot of work, but I don't think anyone should be surprised, and it should be part of medicine. And then people complain about their dental bills. I mean, think about it. People spend more on a haircut than they do on a dental cleaning. And do you know what the setup is and the overhead is what the hygienist has to be paid, to do the job properly, and then what happens on the back end, sterilizing instruments and providing a safe operatory that is clean. I mean, haircut stylists, I mean, it's just a room with a special chair and some scissors. And I'm not, that's a very important skill. I'm getting my haircut. I have to be careful in a few days. So it's just, if you're getting charged $110, $120 for a cleaning, I mean, please give me a break. That is one of the best things you can do, for your overall health. And so the mouth is a lot of work, but think about it. Look where the mouth is. Look what's going into the mouth. Look what the mouth is sampling. Look, you're breathing, you're chewing, you're trying to maintain the only inanimate object that pierces out of the body. The fingernail doesn't count. That's something different. The teeth, this inanimate object that you're trying to keep the rest of the body clean. What happens in the mouth can spread to the rest of the body. You're sampling the environment through your nose and your mouth. You're smiling, you're communicating. You're beginning it's the opening to the digestive tract. It's the beginning of digestion. You're making sure you're not taking in any bad foods or poisons. The mouth is an integral part of the body, and it's very important. And yes, it does need a lot of maintenance.
Yeah, no, I'm not saying it's not worth it. It definitely is. It's just making people aware of the complexity of the mouth and everything connected to it, which is the whole body when you get down to the root of this. And just understanding what it is and how to properly take care of it. Because for a lot of people, it's just brush twice a day, floss once a day, go get your teeth checked out by your dentist maybe 1 or 2 times a year, and maybe nuke the bacteria in your mouth with some mouthwash every day. And it's like, there's a lot more to it. And it's
not just a bunch of teeth in there.
You need to get fascinated by it and to embrace it, because it's a lot of work.
It is.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
We use the word metal, we use the word amalgam, silver fillings. They're all the same. They're half mercury and half silver, and they add other alloys in there. So a lot of people are going to their dental offices. They're saying, take them all out. It's not being done properly, and they just inhale.